This video is for educational and informational purposes only. It is not intended to diagnose, treat, cure, or prevent any disease. Nothing in this video should be considered medical advice or a substitute for professional medical care. Always consult your physician or a qualified healthcare professional before making any changes to your medications, blood pressure targets, or treatment plan. For decades, people have been told the same message in the doctor's office. Get your blood pressure to 120 over 80. That's the perfect number. Lower is always better. It sounds simple, it sounds reassuring. But for many older adults, that advice may actually be dangerous. Recent research focusing specifically on seniors has revealed something deeply concerning. A large study followed more than 15,000 adults over the age of 75. These were real people, living real lives, with common medical conditions. The results shocked researchers. Older adults who were pushed down to the so-called perfect blood pressure of 120 over 80 had higher rates of dizziness, fainting, falls, fractures, hospitalizations, kidney injury, and even death compared to those with moderately higher blood pressure. So how can a number considered perfect actually increase the risk of dying? Because 120 over 80 is not perfect for everyone, especially not for older adults. To understand why, you need to look at what actually happens inside the aging body. Margaret was 78 years old when I first met her. She had been managing high blood pressure for about 10 years. When she was diagnosed at 68, her blood pressure was around 152 over 88. Not ideal, but not immediately life-threatening. Her doctor started medication and gradually increased the dose. After a few months, her blood pressure dropped to 138 over 82. Good progress, Yermont, her doctor said, but we want you at 120 over 80. The medication dose was increased again. Later, a second medication was added. Margaret trusted her doctor completely. She took her medications exactly as prescribed and monitored her blood pressure faithfully at home. Eventually, her numbers reached 122 over 78. Her doctor was pleased. "This is perfect," he said. "This is exactly where we want you." At first, Margaret felt fine, but soon she noticed something unsettling. Every time she stood up, she felt dizzy. The room would spin for a few seconds. She had to grab onto furniture to steady herself. She mentioned this to her doctor. "That's just normal aging," he said. "Stand up slowly, drink more water." But the dizziness didn't stop. It happened every morning when she got out of bed. Every time she stood up from a chair, every single time. Margaret became cautious. She began preparing herself mentally before standing, bracing for the dizziness. Her daughter noticed and urged her to push harder for answers. When Margaret called the clinic again, she was told that as long as her numbers looked good, the symptoms were probably age-related. 3 months later, Margaret woke up in the middle of the night to use the bathroom. She sat up, swung her legs over the bed, and stood. This time the dizziness was severe. The room spun violently. Her knees buckled. She reached for the nightstand and missed. She fell hard and fractured her hip. Paramedics checked her blood pressure. Lying down, it was 118 over 74. Sitting up, it dropped to 94 over 62. Standing, it fell to 82 over 54. Her blood pressure was collapsing when she stood up. This condition is called orthostatic hypotension. Margaret required hip surgery. The surgery itself went well, but recovery was devastating. She lost her independence. She became afraid to move. Her activity level dropped sharply. 6 months later, she developed pneumonia. Her weakened body could not recover. Margaret died not from a heart attack or a stroke, but from a cascade of decline that began with blood pressure pushed too low for her age. This story is tragic, but it is not rare. As we age, the body changes in ways that make aggressive blood pressure lowering risky. First, blood vessels become stiffer. Aging arteries do not expand and adjust as quickly. That means older adults often need slightly higher baseline pressure to maintain adequate blood flow, especially to the brain. Second, the body's automatic blood pressure sensors become slower. In younger people, these sensors react instantly when you stand. In older adults, the response is delayed. If blood pressure is already low, that delay can cause dizziness, imbalance, and falls. Third, medications affect older adults more strongly. Kidney and liver function decline with age. Medications stay in the body longer, and can lower blood pressure more than intended, especially overnight or when dehydrated. Fourth, the risks change with age. In younger adults, the main danger of high blood pressure is long-term damage over decades. In older adults, the immediate danger of blood pressure being too low is often greater. A fall can trigger rapid loss of independence, disability, and death within months. When researchers looked specifically at adults over 75, they found that the lowest death rates were often seen with systolic blood pressure between 130 and 140, not 120. People whose blood pressure was pushed below 120 had higher rates of falls, kidney injury, hospitalizations, and death. Meanwhile, very high pressure increased stroke risk. For many seniors, the safest range was not too low and not too high, but moderate. Blood pressure also has two numbers for a reason. The top number, systolic, matters most in older adults. The bottom number, diastolic, should not fall too low. Diastolic pressure below 60 can reduce blood flow to the heart and brain. When blood pressure drops too low, brain blood flow decreases. This can cause dizziness, confusion, fatigue, poor concentration, and over time may contribute to cognitive decline. The kidneys also need adequate pressure to function properly. For many older adults, general target ranges often look like this. For adults aged 65 to 75 who are generally healthy, systolic pressure around 130 to 140 is often appropriate. For adults 75 to 85, systolic pressure around 135 to 145 may be safer. For adults over 85, or those who are frail, systolic pressure around 140 to 150 is often prioritized to prevent falls and preserve quality of life. These are not strict rules. Individual targets should always be discussed with a healthcare professional. One factor matters more than any number on paper: what happens when you stand up? If your blood pressure drops significantly when you move from lying down to standing, your risk of falls increases dramatically. You can check this at home using a blood pressure monitor. Rest lying down for 5 minutes and measure your pressure. Then stand up normally and measure again right away. A drop of more than 20 points systolic or 10 points diastolic suggests orthostatic hypotension and should be discussed with a doctor. A blood pressure that looks good sitting down is not safe if it collapses when you stand. Blood pressure is not just a number in your medical chart. It affects how you feel, how safely you can move, and whether you can remain independent. If you are older and experiencing dizziness, weakness, fatigue, or unsteadiness, do not dismiss it as normal aging. It may be a warning that your blood pressure is too low for your body or that medications need adjustment. Use this information as a starting point for a thoughtful conversation with your healthcare provider. Advocate for yourself. Ask about standing blood pressure, symptoms, and age-appropriate targets. Because one number does not fit everyone. And for older adults, lower is not always better.